I was 28.5 stone. If I did 1,000 steps a day, I probably did really, really well. You know, you'll hear me say and you'll smile when I say it about the life-changing, life-saving. That's exactly what it does. I wouldn't think anything of walking 15 to 20 miles in one day now. My name's Phil Chatfield. I work in recruitment and I've recently had weight loss surgery. If I went back to sort of 2012, I led quite a sedentary lifestyle. I was really lethargic all the time, you know, I'd sleep quite a lot. Television programs, sofa, bad food, those were probably my hobbies if I'm really truthful. You know, I used to buy clothes from America, from Italy, because you couldn't just walk into a high street store and get clothes. My cholesterol was off the chart, my blood pressure was off the chart. I'd got diabetes that I didn't know I'd got that was off the chart. I sort of remember having a bit of a laugh and a joke with the doctor saying something along the line, so I've got sort of 12 months left, doc, and he said 6 if you carry on doing what you're doing today. Which was, at the time, probably a real wake-up call for me, but I knew I had to do something that was permanent. I couldn't do something that was temporary or something that I could fudge in that sense. So, yeah, for me, I knew at that point that I needed to start doing some research. Then it happened really fast. I did speak to the GP surgeon about having some form of weight loss surgery. It was a little bit difficult in the sense that the sort of timescales they were talking about to the timescales I was really looking for, well, you know, they just weren't aligned. I would have probably had to wait 4, 5, 6, maybe even 7 years for surgery after jumping through lots of hoops that in my own mind I believed I'd already sort of jumped through in terms of trying, you know, fad diets and so forth and so on, or trying to be good, that I know was never going to work for me. So I decided to fund it myself. I'd done my homework on Ramsay Health online, looked at their website, liked the look at them, reached out to the telephone number on the internet, which got me to Shelby, who, you know, answered and put me at ease for everything that I needed to know, and then quickly put me in touch with, you know, the surgeon's team and so forth and so on. And I suppose really, if I went from literally August to the 6th of October, you know, 10, 12 weeks, less than 10 to 12 weeks, you know, from real starting the process in terms of speaking to somebody at the organisation to having my surgery done, you know, I couldn't have wished for anything better. I attended Ramsay Health in Manchester for my surgery. The staff made me feel amazing, you know, from the moment I arrived, the lady on reception, to when I entered the ward, you know, and I spent some time in my little room with my wife, and they came in and checked with me and that sort of stuff and run some different tests. I signed some different sort of paperwork and that sort of stuff, but yeah, it was all really smooth and you were put at ease, you know, sort of every step of the way really. I came around sort of 2 or 3 hours later, and then my new life started from there really. The support package that came with my surgery lasted for 2 years, but with an open door policy after that time, that if ever I have any issues or any problems, or if I need to speak to anybody, those people are a phone call away. It was really important to me to get that sort of support package. You know, I knew I was going to need some help and support. Whilst I think, you know, I can do it all myself, I needed that help and support. So for me to then, you know, I get home on the Friday, I get a phone call from the bariatric nurse, the team there, the dietitian set everything up for me so I knew what I was doing. Then I could adjust things, add things in, tell them different things and so forth and so on. But yeah, that worked really, really well for me. It wasn't a breeze by any stretch of the imagination, but heavily rewarding, you know, something I wouldn't change. You know, if there was something I could say to people today that was that really came from me, was the fact that if you can do this, if you can take this opportunity to save your life and change your life, I would absolutely do it, because I'm living proof today that I can be, you know, today 13 stone lighter than where I am and living an active, healthy life that I wouldn't have been able to live before. You know, life is so much better now. You know, I'm so much more active. I'm so much more healthier now than I ever used to be. I just had some blood tests back in the last sort of couple of days that have now said that my diabetes is in remission. So I'm now non-diabetic. You know, they said that wouldn't happen, but, you know, due to the effort that I think I've put in, due to the service that I received from Ramsay Health Care and the surgeons and all the things that made today possible, it's really, it's overwhelming really sometimes. It's completely life changing in comparison to where I was.